Hi, I'm Claire. I'm Comms and Marketing Manager here at Make Seconds Count, and I'm talking with Pauline today, who is a retired advanced breast clinical nurse specialist. And we're going to be talking about advanced care planning today as part of our Dying Matters series. Pauline, thank you so much for being part of this interview. Can you tell us a little bit about yourself and your background, please?
Yes, hi Claire. Thanks for asking me to do this. I'm very pleased actually that I've been asked to do it. Well, my background was up until last year, and for 40 years I've been part of the NHS in Scotland, and for 35 of those years I worked in an oncology unit, the Beats in West of Scotland Cancer Centre in Glasgow, and for 25 plus years of that I was specifically working in breast cancer as an advanced nurse specialist. So I had a lot of experience, and apart from my day-to-day clinical job, I also sat on the managed network as the lead for the West of Scotland. I travelled extensively. I was very lucky to be able to go to conferences all over the world, really. And yep, I've had a varied career within breast cancer. Well, advanced care planning, it's a title that covers all sorts of things. Mostly for patients and families, it tends to be the advanced care planning for when somebody's at a critical juncture in their disease trajectory. And what I mean by that is when people are coming to the end of what would be active treatment and actively planning for, say, palliative care. Now, palliative care should always be from the beginning of somebody's advanced cancer journey, if you like, but often patients don't want to talk about palliative care at that point because they're very much focused on what treatment they can have and how long they're going to live, and you know what this all means for them and dealing with the shock of a diagnosis like that. So often it does come in a bit further down the road, in that patients get to a point where they are ready to talk about advanced planning for when they're no longer here. And that's especially difficult, if women or men have kids, especially younger children, and what that means in terms of leaving them behind. So advanced care planning should encompass all of what their wants and needs are for when they're getting to that point where things are really serious and they know that they don't have long. My role in that over the years went from being in a room along with a medic when this was being discussed to the point where, because of the role I had and because of the kind of advanced clinical nature of my role, I was often the person who would actually have that conversation with patients and their families. And, over the years, you may be the person that knows that patient and their family better even than the medics that are treating alongside, because we work very much as a team. So it wasn't that hard conversations were always done by doctors. They're often done by nurses in this situation, because you know the patient better than anybody else. The longest I ever looked after somebody with secondary breast cancer was 15 years. And there's a young girl who was diagnosed at the age of 29, 44 before she actually got to the point through treatments and everything that she died. So for 15 years I looked after that girl and her whole family, and you're often then the one that has that difficult conversation with them about, not withdrawn active treatment, but no active treatment left to give. It's truly in about realising that things certainly have to be sorted out in terms of sometimes financial, sometimes emotional, sometimes, housing, sometimes, all sorts of different things in advanced care planning. The transition has to be as easy as possible for everybody involved. And sometimes that can actually be even supporting the staff that are looking after patients, not so much myself, but junior members of staff, even sometimes, because we still have feelings. You have to put that aside, but you still have to do your job in terms of being there for the rest of the time for the patient and their families.
Yeah.
So yes, but I mean, it can be difficult, but I also would say, as a member of staff, it was an absolute privilege to be with people, and you feel as if that it's the last thing that you can do for that patient and their family is to be in the right place at the right time and sort things out to make things as easy all round for folk. Practical, emotional, making sure paperwork's finished properly, make sure certain things have been put in motion so that the transition's as easy as possible.
Mm. What are some of those things that can make those conversations easier in your experience?
I think, there's lots of terms bandied about in kind of medical literature about having a therapeutic relationship with patients. It's getting to know the patients as well as you can, getting to know that their wants, their likes, what's important to them, what can be set aside, what is going to make anything easier, in terms of, as I say, making that transition. But there's nothing easy about these conversations, and sometimes it can get very emotional. And given sometimes it's actually knowing, it's having the experience to know when somebody actually wants to have that conversation
Mm.
or not. And that sometimes is down to experience, really. There are times when, especially when someone's first diagnosed with secondary breast cancer, often the questions asked is, how long have I got? And that's not an easy question to answer and at any time. And you sometimes can judge that actually that's not what they really want to know.
Mm.
And you just have to kind of park it to the side a bit until further down the road.
Mm.
And we often sort of don't really give a direct answer to some of that straight away. We try and sort of guide them to maybe other questions that they might need, in terms of treatment and things. But at some point, you will have that conversation. But I think it's often difficult at any point in dealing with that situation,
Mm.
especially if you have known somebody for a very long time.
Mm. You just touched there on life expectancy. Can you explain to me more about what stats mean and, in your opinion, whether it can be helpful or unhelpful to talk about life expectancy?
It can, and often, especially at the beginning, when somebody's just first diagnosed with secondary breast cancer and they're dealing with the fallout of having that diagnosis and the realization that their disease is incurable, you can, we often say to patients not to go online and don't Google certain things because it will frighten them to death, really. And it often is worse looking in black and white figures like that. It's the extremes of things. And you often say to somebody, you're not a statistic, you're a person, and what's statistically written in black and white doesn't always pertain to that person, depending on what type of breast cancer they've got with their secondary disease, whether it's estrogen positive, whether it's HER2 positive, whether it's triple negative. There are different, statistics for all of that. And some of it, looking at it in black and white, can be particularly unhelpful because it can shock patients. So statistics are one thing, but people are another. And, you try and sort of say you're not a statistic. And they can be helpful in a guide that maybe gives folk a rough idea of what it is. And the statistics haven't really changed very much in the last few years, despite advances in treatment. But you do have to try and talk around what that kind of means. It's usually averages. It's not a person specifically. And they can be helpful to guide people, but they're not the absolute for that person. It doesn't mean that that's where they are. You know, as I say, you can look after people who go through treatment very quickly and don't have a lot of time, and then there's the other extreme where, as I say, the longest I've looked after somebody's 15 years.
Mm.
So, there's a lot in between all of that, and statistics only talk about the averages rather than the person.
Mm.
And it's a difficult concept for patients to understand as well, statistics.
Mm.
For some staff, it's hard for them to understand it, but the statistics often are, because of clinical trials and everything else, and, it doesn't really pertain to the average patient.
Mm. The support that we kind of offer here at Make Seconds Count, is there any additional support that we could give to help people around this subject at all of advanced care planning, or what kind of advice would you recommend?
I mean, I think you could put some stuff online about the practicalities of advanced care planning. There are some good organisations there, that let people know how to, because yourself, if somebody's dying, and then when somebody does die, there's a lot of paperwork. There's a lot of logistical things that need to be done, and usually you don't want all that left maybe to the family to have to deal with. So there's lots of things that you can deal with before you get to that point.
Mm.
And I would say one of the important things is, if you're putting stuff online, is to talk to people about leaving a will. It's very important that people even just record their wishes somewhere, because there's nothing worse than, I would say, leaving a mess behind. And yet, you can't say that if somebody doesn't, plan for the end, there's something wrong with that. It's just that maybe not that they can't manage to do that kind of a thing, and you would hope that somebody maybe in the family would be able to maybe step up and help and say, look, I'll take that away from you. I'll deal with X, Y, and Z. While you can just concentrate on being as good as you can be. But often, if people don't leave some sort of wishes behind, then it can be difficult for relatives and friends or whatever, who are actually dealing with your the consequences of that can be make that more difficult for them. You to then deal with all of the logistical things that need to be sorted out for somebody, and simple things as well. It's an extra burden. But, people have to be able to take a step back and deal with that. And that's often really difficult for folk when they're going through treatment, to look at that part of it and to see where, as I say, regardless of, we hope that people live a long time with the disease, um, you know, and manage to live a long time with the disease. But for some folk, it comes too quick for them, and there may be no time to sort certain things. So if you can give a list, if you can put stuff online to make it easy and practical, and sort of other, as I say, there are good organisations around that can help with future planning for things. But I think as a charity, I think the actual peer-to-peer support cannot be underestimated in these situations. As I say, I've dealt with patients with secondary disease for many, many years, and I would say it was a privilege of my job, but I still don't know what it is to be in somebody's shoes like that. And the peer-to-peer support that people can have is unmeasurable, really.
Thank you so much for your time. I wonder, is there any other things that you think is worth sharing, or any questions that you think I should ask you that we've not really touched on that I could include?
Well, I do think, in terms of people's wishes, I think another thing that you could probably put on the website, or online, is when people look at organ donation per se. You often think that patients with secondary disease can't donate organs, but they can donate corneas and things. And to give the gift of sight to somebody is quite a thing. So there are other things that people can do that still makes them feel as if, you know, they've contributed in some way. And that can be helpful to people to think that, you know, that their life has had that kind of a meaning. So that, as I say, there's lots of things around those subjects that people probably don't know about.
Yeah.
Another, you know, under talked about is the kind of services for children who are maybe, you know, have a parent, and there are some good bereavement services that are available. And often you're either yourselves as a charity or their local nursing team who are looking after them will often know about these services. So I do think, you know, an advanced care planning is such a difficult thing for a lot of people, but it's such a crucial thing as well. And we, you know, it's the chance that people have to record what they want to do, you know, and for some people that's a really important thing, you know, whether that's letters, whether it's photographs, whether it's memory boxes, whether it's, you know, as I say, just letting their relatives know their feelings on things. It can be quite an empowering thing for patients, and it's such an important question to ask. Really, is what do you want to record? What do you want to know? What do you want left behind? You know, it's so important, and it sometimes it does creep upon folk quite quickly, and they maybe run out of time to do these things. So I think the earlier you can, you know, talk about, you know, this is your chance to do things, or as I say, record things or write things down, the better it is, really.